Hi, thank you for joining us, Dr. Eucker. And to start off our conversation, could you share with us what promotion of COVID vaccination in the emergency department is focusing on?
Yeah, basically, as we all know, the COVID-19 pandemic is one of the worst global diseases in recent history. And vaccines are a proven way to reduce both the transmission of this deadly disease as well as its severity. And so we really want to be able to promote increased vaccination rates amongst all people. There are a lot of people, particularly in our country, who are hesitant to receive this vaccine for a number of reasons. And so our goal is to identify these reasons and address them through a combination of flyers, videos, discussions with ED providers, in order to try to address people's questions and concerns with the overall goal of increasing their desire to receive the COVID vaccine.
That's really neat. And so what would you want people to know about the work that you're doing here?
Well, it's actually exciting that it coincides with our own emergency department clinical team efforts to administer the COVID vaccine to patients while they're in the emergency department. So we'll actually be able to couple the COVAXX messaging, that's the acronym for the study, with giving the vaccine right there in the emergency department.
That's awesome. So where do you kind of see this work moving that you're doing towards in the future?
Well, basically we want to increase vaccinations in order to decrease the death and disability that's been caused by COVID. So we really want to try to vaccinate as many people as possible. This is going to be particularly important if we start needing booster vaccinations due to COVID variants or decreasing immunity from the vaccine over time. So by creating an evidence-based messaging to help people understand that the COVID vaccine is safe and effective while making it conveniently available during their emergency department visit, we're hoping to really improve the overall numbers of people getting vaccinated, in particular the patients seen in the ED whose only health care is actually in the emergency department.
That's really neat. Well, thank you so much again for taking time to share with everyone about what you're working on.
Yep, my pleasure.